My name is María-Victoria Mateos, and I work as a hematologist at the University Hospital of Salamanca in Spain. I am attending the ASCO meeting in Chicago, and I will present the results of the phase 1-2 trial conducted in relapsed or relapsed and refractory myeloma patients in which pembrolizumab, a checkpoint inhibitor, PD-1 inhibitor, has been combined with lenalidomide and dexamethasone, one of the standards of care for patients with multiple myeloma at relapse or disease progression. In this phase 1-2 trial, 51 patients were included, and during the first part, the main objective was to try to identify the maximum tolerated dose. For this purpose, 3+3 design was considered during the first part of the study, and 2 milligrams per kilo of pembrolizumab in combination with 10 milligrams of lenalidomide and 40 milligrams of dexamethasone was the preliminary maximum tolerated dose, but during the dose confirmation phase of the study, 7 additional patients received this combination, and the maximum tolerated dose planned for the dose expansion cohort was 200 milligrams of pembrolizumab IV every 15 days in combination with the lenalidomide at a dose of 25 milligrams on days 1 to 21 and dexamethasone 40 milligrams once per week. Safety profile was acceptable, and in fact the toxicity profile was consistent with the toxicity profile previously reported for lenalidomide and dexamethasone and also for pembrolizumab. I would say that approximately 30–40% of the patients had grade 3–4 hematological toxicity, mainly neutropenia and thrombocytopenia. Few patients had immune-related adverse events previously reported in other trials with pembrolizumab treatment. Some patients had hypothyroidism, hyperthyroidism, but most of them of grade 1 and 2, and in fact no patients needed to discontinue the treatment due to these immune-related adverse events. In terms of efficacy, I would like to remark that the median number of prior lines of therapy was 5, indicating that we were dealing with a heavily pretreated patient population. In fact, most patients were previously exposed to bortezomib and immunomodulatory drugs, and a significant proportion of patients were refractory to lenalidomide. And in this situation, I would say that 50% of the patients responded to this combination, including some patients in stringent CR, complete response, VGPR, and partial response. In fact, if we focus on the group of patients who were lenalidomide refractory, we observed also as approximately 40% of the patients responded to this combination, indicating that the addition of pembrolizumab was able to overcome the lenalidomide refractoriness. If we consider the patients who responded to pembrolizumab in combination with lenalidomide and dexamethasone, I think that it is remarkable that the median duration of response was of almost 1 year. And in fact, I can say that more than 75% of the patients remain alive at the present time, indicating that this combination is effective in a heavily pretreated patient with multiple myeloma, and in addition, this combination is contributing to prolong the overall survival of myeloma patients. And of course, the final message is that the investigation with pembrolizumab continues, and in fact there are currently ongoing some phase 3 clinical trials that will evaluate in a randomized way the role of pembrolizumab in combination with Lendex or in combination with pomalidomide and dexamethasone.